We'll see.
For Western Media, this is Isabella. Don't crack me up in the intro. I'm here with Doug, and we'll help you make money in the stock market with information you can't find anywhere else.
And presenters. We have super good healthcare stuff, exciting things all day today.
Yes, we do. I was so excited when I read over it. Oh my god, I was passed out.
Something that we were all hoping for.
Oh no, I have to behave myself today. We have a lot of very important information to relay to you. So
let's go.
Let us stay on task. Yes. Otherwise, the German might, attack. Oh no, he's not pleased. He's switching the cameras until I behave myself. Okay. All right. Kevin Poulos, Chief Commercial Officer for Optimer Pharmaceuticals, OPTR, spoke about 2 drug candidates in Phase 3 testing for the treatment of diarrhea, Opt-80 and prulifloxacin. The latter has performed well against CDI or C. difficile. I don't know. Difficile?
Difficile? You don't know difficile?
I know difficult, yes. I prefer the Italian. I love Italian, oh my god. Anyway, sorry. That was one of my other personalities, intruding my well-behaved personality is the one that is on camera today. Mark is just shaking his head. Alright. C. difficile, a superbug with no cross-resistance and convenient dosing. I don't think anyone's going to understand that particular note.
No, we're sorry. We'll be back later with the sober co-host.
People ask me that all the time. Why are you so happy? What are you on?
I know, and you never share. Although, you share your personality.
I so in a way I share what I'm on. I mean, not that I'm on anything. Julian Adams, President of R&D and CFO for Infinity Pharmaceuticals, INFI, discusses the development progress of IPI 504, an HSPN0 inhibitor, and a hedgehog cell signaling pathway inhibitor, both targeted cancer therapeutics. They have partnered with AstraZeneca.
Yeah, which is nice to have a good, big brand name partner.
Oh, that's a big brand name? I was just thinking AstraZeneca.
No.
Who comes up with these names? That's fantastic! It's just utterly fantastic. That's the best part of my day. Really. Poetry.
Yeah.
Sorry.
Got my French poet. We have to introduce to the nice people.
AstraZeneca. I'm going to have to look that up.
You take my word on it. I told you they're a big name.
I don't care about that. I care about who came up with this name and what did they do.
Now you look up. You look up and let you.
Why? Astra Star Seneca. It's right. It was an Indian name, right? Okay. Anyways. Wow, you're gonna get angry letters.
It's really making me weep. I obviously worry so much about that.
I promised to behave myself today. Okay, so I hate breaking my promises. Larry Bullock, CFO of Biomimetic Therapeutics, BMTI, discussed the biological solutions for tissue regeneration and yesterday's announcement of Augment as the new brand name for their orthopedic product line. Augment?
I figured that might be an area in which you have expertise.
Orthopedic product line? Are you now mocking people with that particular disability? Do you really want to be known for that? Okay, I'm so fired. Just kidding. He would never mock anybody. He's a very, very warm, kind person. Yeah.
People are believing that.
Sean Guz, VP for Tomotherapy, TOMO, discussed the high-quality image scanner, HiArt, and the next step in innovation, which is adaptive radiation therapy, in which physicians have the ability to account for tumor shrinkage, patient anatomy changes, and actual radiation delivered each day. He also speaks about the acquisition of Twin Peak Linear Accelerator, saying the transaction should close in the third quarter of 2008.
Wow, look at this, man. Had you ever managed to get here in time, like say while the market was still open, these guys are up 20% today.
I have better things to do.
Like what?
Go to castings where, my soul is basically ripped out of my body, shredded into a little ball, and thrown out into the New York City streets.
Yeah, but then you fall into our loving arms and come with us.
until I'm fired. Okay,
These guys are up 20% today. Super good stuff, man. What else do we have?
We have John Hodgman, SVP and CFO of Intermune ITMN, described 2 products in clinical development. Perfenadone, which has FDA Fast Track status and is in a phase 3 trial for idiopathic pulmonary fibrosis, and ITMN 191, which, in partnership with Roche, is in a phase 1 trial for hepatitis C. Why would something have Fast Track FDA status?
There might be another drug may be coming off patent or expiring, or there might not be any kind of suitable treatment right now for it.
Oh, that's interesting. Okay. Robert Conway, CEO of Array Biopharma, ARRY, outlined the company's development pipeline, including cancer and inflammation pain drugs. They expect to have proof of concept on 6 100% Array-owned programs by year-end of 2009.
Yeah, fantastic stuff, man. We work with these guys quite often. They're very near their 52-week low, and they have an awful lot in their pipeline coming out. And that's really not very far, year-end 2009. For
it's the future.
It's the future. We can't fool you.
The near future, but the future nonetheless.
But for biotech, it's like this.
Oh, really?
Yeah.
God, remember when you were little and time just dragged and dragged and dragged, and now just time goes by so quickly? Mike is not happy with me. Okay, anyway, my little asides, my little philosophical, existential asides. Okay, anyway, Ron Zwanziger, CEO of Iverness Medical Innovation, IMA, discussed acquisitions completed last year and talks about the R&D pipeline, including the Klondiag platform, which includes the array tube readers and microwell array strip processors, to be released at the end of this year. Michael Davin, Chairman and CEO of Cynosure, CYNO, discussed the different energy source workstations, such as the pulse dye laser or Alexandrite laser, used in their technologies. He also talks about their new product, a dual wavelength smart lipo
for
MPX for body sculpting. What are you saying? And Affirm for anti-aging.
Do you know how long it takes us to find the right people to read these?
And I'm just going to keep reading. And Accolade for pigmented lesions. They opened a sales office in Beijing today. Because my mother said, if you have nothing nice to say, you shouldn't say anything at all.
Really?
Yes.
Did you?
Yes.
Yesterday you were laughing at some of the people's diseases. I guess she didn't mention laughing.
She says, laughter's the best drug.
Yeah.
The best medicine. So
Okay.
yeah. I was actually helping those people.
You're actually on laughter.
I'm on laughter. No, it suddenly feel really sad, stuff. Oh, wait, because we're done. That's why.
Come on, tell the nice people goodbye.
Do I have to? Okay. We're here every day, Wall Street Media. You can find us directly at wsmco.com. Thank you.